We're here at the JJS Dentistry Cape Town waiting room, and I'm here with our founder and innovative dentist, Dr. JJ Serfontein. And we're here to discuss a few questions that we get quite a lot from patients. We've been in the field, or you've definitely been in the field for a very, very long time, and there are a lot of questions surrounding dentistry that goes around that people really want to know. And most of the time, things out there covers the basics, which toothbrush to use or whatever. What people really want to know is the controversial topics. And that is what we're here to discuss today. So, I am happy to be here to have a conversation.
Yeah, thank you, man. I think it's good. It's something that we should be doing. As you said, we get these questions all the time. Mm-hmm. And over the years, that's been our great passion, isn't it? And we find that people are generally very much unaware of the type of treatments that's out there, the stuff that they can have done. What are all the pros and the cons and all these things. So I think it's important to discuss it because education to the patient is really extremely important to us.
Yeah, and I think we can jump straight in because I can already tell that our viewers will definitely love this fascinating discussion.
Good, let's do it.
And so our topic today is we're focusing on why is dentistry failing people in 2025, right? Because it feels like so many dentists are still focusing on patching the problem instead of educating patients about prevention. And why do we find that is? Why do you think that is?
Oh, I think it's multifactorial, and you're 100% right. I mean, to just first of all say that dentistry is failing patients, I mean, what a controversial statement. Although we do see that, I think in 2025, surely it shouldn't be like that anymore. That people go to dental practices, they go to dental teams, and yet they're not improving their health. They're not improving their life. And as you said, it's mostly about just this patch scenario. Look, I think it's multifactorial. And it's going to obviously be different. In many different practices, in different towns, different cities, different countries, and we'll get into that a little bit later. But I think it's difficult. It's educating people, right? It's multifactorial, and I mean, first of all, I think there should be a passion for that. If you're sitting in a dental practice where it's more important to get people in the door, treat them as efficiently as possible, as quick as possible, and get them out of the door, not wanting to spend the time to educate them, to make the patient understand what is going on. Why is the stuff failing? Why is it not working? If I'm going to do a filling on you, I'm going to do a crown, I'm going to do a smile and implant on you, what is going to be the pros and the cons? How long is this stuff going to last? Why did it happen in the first place? So first of all, if there's no passion, and then you've got to understand, if the dental team doesn't understand it, I mean, it's hard. It's cumbersome. It takes time to sit down with people and explain to them exactly what it is, and so if there's not a passion for that, to really, to get that moment in a patient's eye where you can see the light just went on. They've been struggling with the same problem for so long, and all of a sudden, oh my goodness, I never understood that. And again, then if we talk about 2025, that happens to us on a daily basis, where people have had a root canal done 6 months ago, and yet they still don't know what they have, So I think failing, maybe certain sectors, but there's a lot to be improved on. And I think at the heart of all of that is patient education and explaining that, and it's definitely not being done to the level that it should be.
You talk a lot about passion and dentistry, being a passionate field. Sometimes we see a lot that the people in the dentistry field, they're not passionate about what they do. And I think a lot of that can be linked to the fact that patients have such a negative outlook on dentistry. Why is dentistry still seen as a painful visit, while there are so many other things that people do, like Botox, like plastic surgeries, that are a lot more painful, and they still go?
And even the cost, sometimes we can throw cost in there as well, whereas you're 100% right. There's still this frustration from our side that people still see dentistry as you said, it's either painful, it's expensive, it's not necessary in most of the cases. And I think it comes down, ultimately, we talk about that a lot, but I think it's the value. I think it's the the fact that they don't understand the value. It's just something that they want to go into the room. I don't want to be educated. I really don't care. I just want to walk out here. I'm in pain. I need to get out of here. They're not interested in what's going on. What am I getting? They want to look at the bill. They wonder, how long is this going to last? And that's about it. So I think people don't appreciate and they don't understand the value. And I think, so when you're going to talk about education and educating a patient, surely also you as a dental team need to understand the value. You have to believe that if I'm going to put a veneer on a patient, that is actually the right thing to do. And understanding these treatments truthfully, then I say, but then I'm not selling a treatment, is it? Now I'm educating a patient that they understand it and they can feel the value and the impact that that's going to have.
So that kind of links into our next question is, do you believe the dental industry prioritizes profits over people's health and education?
Yeah, I think we get a lot of, we just talked about the finance part, and I think a lot of people do feel that, is that stuff is expensive. I'm going to have to need a crown now. It's going to be thousands of rands, to be able to do this. And, our short answer for that is usually, these things will probably last 10 years. So, how often do you go to the dentist? It's not something that you're going to have every day, yet you'll go to the hairdresser and you'll pay thousands of rands, and that only lasts 3 months. You'll buy a pair of shoes, that you feel beautiful in, and it's wonderful. And please don't get me wrong, I think it's fantastic. But the thing is I think there's this discord or this misunderstanding that dentistry can give you that same type of value ultimately. And so when it comes to people's expectation of whether profit is what's driving it. Now, of course, under treatment versus not having enough knowledge and patching, also the flip side of that coin becomes over treatment. And I think in those circumstances, and again, it's not an umbrella thing. We see people from all different walks of life, and they've come from different practices from different countries. But yes, I think there is possibly a side to that. But I would like to believe that I think, especially in South Africa, especially in Cape Town, we're very privileged to have many practices that are very passionate about what they do. And at the heart of that, there is truthfully a patient care component to it. So profit driven, I don't think so. To be honest with you, I think, first of all, I think in being in South Africa, if you first of all going to think you're going to be a billionaire from dentistry, you got it wrong anyway. So don't even try to change that, because it doesn't work that way. But I think, does it happen? Sure. Should it be happening? Definitely no. I think at the heart of it, it's all about patient care. But no, I don't think profit. It's expensive, sure, but it's definitely not about the profit. Definitely not.
So you talk a lot about patient care being the heart, and why do you think, in your opinion, is preventative care not at the heart of most dental practices? Because we do see a lot of people going in and out. They don't know what happened. They don't know what was done. They don't know what the state of their mouth is, or how to prevent future issues. So where do you think that gap comes in, where prevention is not a key aspect?
Yeah, I think one of the buzzwords, isn't it? Preventative health care. We're all talking about longevity and living better lives for longer. So surely preventative health care, dentistry included, should be the order of the day. I think mainly, again, it's about education. It's about the passion of the team. We've had multiple people come through our practice, from patient perspective, from staff members, different dentists, different oral hygienists, and that passion isn't always there. And it's wanting to really care. People, you have to have people that really care, truthfully care for people. Then that is going to come through. That passion is going to come through. That repetitive care, and sitting with somebody and trying to prevent, treating the gingivitis, treating the periodontal disease, and then all of a sudden, 2 years down the line, you start seeing the change. Often it takes as long as that. And when that patient starts to become motivated, it's like anything else. It's like eating better. It's like training. It's like exercise. It's not having alcohol, not smoking. It's difficult sometimes to change those habits, because I think, dentistry, unfortunately, is still seen just as a preventative way of getting rid of pain and infection, and people are not involved in their own health.
So how would you say is this practice in your practice looking at preventative dental health? And what are some new things on the forefront of dentistry that we are looking at when we think about gingivitis and periodontitis and prevention?
I think prevention for us, and the way that we understand it, what we see in our patients, is twofold. If you're going to categorize it, I think you've already talked about the biology side of it, meaning gingivitis and periodontitis. I mean, it is the greatest threat. We're turning 90. We've got a long way to go. And if your bone and your gum is not healthy, doesn't matter how good your teeth are, doesn't matter how good your genetics are, you are going to run into trouble. You're going to lose teeth. And that, of course, being the ultimate problem is losing teeth. So first of all, there's the biology side, the gingivitis, the periodontitis. And then the other side of it is, of course, the mechanical wear and tear. So people are breaking their teeth. They're wearing their teeth down. Nobody gets to 90 and their teeth look like they're 10 years old. One of our mantras. Wear and tear. It's going to break. At some point, your teeth are not going to make it on its own. Some people are fortunate and they can have a filling for the first time when they're 65 years old. But most people don't, you see. And so when prevention then comes in, is to concentrate. And that's what we do in our practice. There's many ways to prevent tooth decay. There's many ways to prevent it. But those are the things that we focus on. It's understanding the mechanism of this system. What does the toes, how they function, how the teeth supposed to function, and then whatever is surrounding it. That gingivitis and the periodontitis.
So you're talking about the system.
The system.
Right? And how do you feel that concept of the whole system and the bite analysis and how everything works together is being overlooked in dentistry today in 2025?
Yeah, I think that's one of the, first of all, I mean, we talk about occlusion, right? And so the way that the teeth function inside of the muscles, the jaw lines, the neck, the rest of the body. So this functional envelope is what we're working with. And I think it's hard. Occlusion is one of those topics that you go to any international congress. I mean, we're pretty sure about how root canals are supposed to go and not go, although it's a controversial topic. We're pretty sure of what veneers should be doing and what a resin composite filling should be doing. But occlusion is one of those topics that there's many points of view. None of them are necessarily wrong, right? And so what you need to do is you need to do the study, really investigate on maybe one of these philosophies, and then master that. And that takes time. It takes trial and error. You have to have a team from a lab technician, from the dentist, from the oral hygienist, and everybody else to understand this. And that takes time. So this is not something that you can watch a YouTube video on. It doesn't work that way. It takes many, many years to actually understand the system. And it's difficult to master it. So most people give up. They just hope that they're going to put something in. We're relying purely, if I'm going to put a crown in somebody's mouth, I'm relying on the technology. I'm hoping that material is going to last and that glue is not going to come loose, that cement is going to fail. And that's what I'm hoping for, right? And it doesn't work like that. It's a science, you see. And with science, you can't fake it. You have to understand it. And so I think that's the problem. It's hard. It's difficult.
So if we are seeing a patient who is coming back often with broken teeth, broken crowns, what is this telling us about the system?
Well, obviously that the system is under threat. And this is going to be very different for every patient. You talk about tonus and muscle, you're going to have two people with more or less the same age, more or less the same wear and tear on the teeth, and you're going to put a crown into the one patient and the other. The one is going to fail, and the other one is going to last 10 years. I mean, we see this on a daily basis. And you can go and check that it has mostly got to do with the system, the aspects of the system. So it's important to understand that, and to educate them. Say, listen, you know what? There's actually a reason why it might not be the dent or the material. Nothing wrong with the material. You got the very best stuff on the market, but it was put in the wrong place. And there's no way. I mean, I had a patient today that had veneers done, and subsequently 2 teeth now broke. So the patient went in, they wanted to do a cosmetic lift, right? That's why they did the veneers. But now 2 teeth broke because they used zirconium as a material, which is the hardest substance that we can have in dentistry. It's a metal. It was put in the wrong spot without having the necessary support, and now 2 teeth broke. I mean, there's your ultimate failure, isn't it? We went from a fairly good functional system with the goal of improving a smile and cosmetics, and now they've lost teeth. You see, now that is the system. It's a powerful system. It's designed to go through bone.
So we have a concept, that many people are talking about cosmetic dentistry, separate from general dentistry. And what I'm hearing from you is that the functional dentistry side and cosmetic dentistry are really intertwined, and that one cannot exist without the other. So why do you think people are only focusing on the cosmetic angle and not the functional side?
Again, I think it comes to the fact that they're not necessarily understanding. They're not taking the time to analyze, to first of all understand the concept of a functional system. And then second of all, taking the time to analyze that specific patient's problems, creating correct diagnoses, right? Wanting to put a material onto a tooth for the sake of purely cosmetics, and then neglecting to understand the forces, the erosion, and everything that's going to go onto that material. And then you're going to end up with, as I said, sometimes catastrophic consequences, or materials that don't last as long. There's no value now, you see. And so in our practice, and this is what I believe, and we always talk about the patients, the cosmetics that veneers, for instance, bring is purely the chocolate part. It's a bonus. When we treat people with veneers, the reason is primarily because they have wear and tear. The teeth are halfway gone. Now we have to put a layer on there to be able to help the function, to improve the biology, the way that they chew, the way that they speak. That cosmetics is a bonus. It's not driven by the cosmetics. If I get a patient with really good teeth, we're not going to do veneers on them. The teeth might just be skilled. We're going to do orthodontics. We're going to do adult braces. We're going to do aligners, because we're going to just move that tooth into a position. So veneers, resin bonding, and all these things, which is generally associated only with cosmetics, it shouldn't be that way. Veneers was designed to do a less invasive treatment as an alternative to old metal crowns. It became the cosmetics of dentistry and its association with it. It's the boobs of dentistry, right? But the point is it's not about that. It's about protecting teeth. And again, if you can understand that, then you can actually help people achieve better health. And then having that confidence after, sure, it's important as well. But it shouldn't be driven by the cosmetic aspect. It's the functionality that plays the role.
So you're talking about, funnily enough, the boobs of dentistry, right? And one thing that comes to mind is the fact that everyone knows that these surgical implants, have a lifespan, that they will need replacement or something at some stage. So what is the lifespan of veneers or dental work that is done in that manner, in a cosmetic sense? What can we expect from it? How long is it supposed to last if it's done properly?
100%. I think again, it's in dentistry, people expect stuff to last forever. It's weird that way, isn't it? Whereas, as you said, if you have a breast augmentation done, you are informed before that you will probably at least once every 10 years have to replace the stuff. It's the same for an artificial hip. It's the same for an artificial heart valve. People can understand that, but for some reason, people expect, because it's probably something that they didn't want in the first place, it needs to last forever. I think the question there is very important, that how long will my veneer last is not the question. How long will my teeth last? That's what it's all about. We need to get people to 90 with their teeth. Our teeth are not going to survive on their own. They will wear and tear. I don't care who you are. Nobody's ever gotten to 90 and their teeth look like they're 10 years old. We have to put something on there that is as natural and as less invasive as possible. If my veneer then pops off 3-4 years down the line, something in the mouth has changed, the bone density has changed, the elasticity of the ligament has changed. What I want to happen is the veneer to pop off. It's not great if you're on holiday and you're in Positano and it's your front one, right? But the point is the teeth need to be safe, right? So it's a sacrifice. It's a controlled failure environment. So in other words, yes, the veneer can pop off, but I'm saving the tooth because before we added these veneers, you were losing your own teeth. So the question is not how long does the veneer last? The question is how long does the teeth last? How long do I have good function? How long can I speak properly? How long can I eat properly? That's the question.
So the teeth serve as then a very important support structure in a sense. And then if you have that good support structure, you can play around with it. You can add veneers, you can do crowns, you can do a lot of that. But in the sense of the support structure lasting, what is the one main thing, except for the wear and tear that you mentioned, bacterial-wise, that affects this?
Well,
is there anything we can taste for? Is there anything we can do going forward to protect the support structure?
Yeah, 100%. I think we talked already about the mechanical aspect and then the biological aspect. You got to remember when teeth start to fail, obviously it has a massive impact on the rest of the system. We start seeing the joints, the temporomandibular joint coming under threat. People start getting popping and clicking. They start getting discomfort and pain and neck pains. People sometimes underestimate, ringing in the ear, for instance, this could be coming from a mechanical failure. So there's this mechanical aspect about protecting the teeth, protecting the joint, relaxing muscles, right? And then, of course, if my teeth are starting to fail and I have now all of a sudden got irregular contours sitting around the tooth, I might have an older filling, an amalgam filling that has a little chip in it now, bacteria start to accumulate and they're going to sit in these areas. So all of a sudden, the bacterial load and the fact that I no longer can control that bacterial load starts to increase. And now we're starting to move in this whole scenario of the actual immune system and the connection that the oral cavity has to the rest of the body and to my natural health and my systemic health. So failing teeth and failing systems is not just about pain and discomfort and cosmetics, but it's also got to have massive biological impact.
So you're talking about that link, right? And do you think dentists nowadays are doing enough to educate patients about the link between oral health and overall body health?
Yeah, I think it's no, they don't. But there's a simple answer for that because it's new. I think this is important. This is something that we've worked on really, really hard. We're now testing for the stuff. We had to go out and say, listen, there's this whole new world opening up for us. We're connecting the oral cavity, finally connecting that to the rest of the body. Up to fairly recently and still possibly is that, the oral cavity is seen as a detachment from the rest of the body. I mean, the medical field, everybody involved in the rest of the body will leave the mouth to the dentist, and the dentist will leave the rest of the body to the medical fraternity. And this is being amalgamated now. So we're starting to understand, and this stuff is unfortunate. It hasn't been around for too long. So we're still in those early phases of understanding this. But it is essential, and it's super exciting, by the way. And this is, as we said, now we've started implementing oral, testing, biological testing. We see, listen, this patient is struggling. They have exceptional oral hygiene. They've got really good teeth, but why are they still having gingivitis? So we can't just say, okay, this is an umbrella treatment. We're gonna chuck antibiotics at them and gonna give them all the old rinses in the world and hope that this is going to be fine. It doesn't work like that. We should also be making a science of this, and that's the exciting part now. We're starting to understand this link, and this is going to be the future for us.
So you talk about this testing. Can you tell us a bit more about how it works? What do you do? Is it painful? Do you draw blood? What is the process?
No, fair enough. It's actually pretty simple. I mean, we just literally, it's a small little paper tip that we have that we utilize in our practices on a daily basis for many years. It's like an oral swab. People remember this from COVID. It's just an oral swab. We just need to get that information around the tooth into the little pocket, and we send it off to the lab. And what we're getting from that is now to see which bacteria is present in this patient's mouth, which of these bacteria are in an overload. And it's fascinating to see the connection between these bacteria, and the role that they play on your immune system, on your calcium distribution throughout the rest of the body, the magnesium, etc., etc. So once you start puzzling this together, it's easier now to say, listen, but Mrs. X, you need a different type of approach. This type of treatment that we're going to give you is actually not going to be successful for you. And so we're honing in and mastering the ideas to make this more specific for every patient. This is going to be the future of healthcare.
So you're talking about, certain supplements, you said like calcium and that. Are there any supplements that, the general public can use or take to improve their oral health or prevent certain diseases?
I think for us in our practice, I think the stuff that we focus on, which we know plays a massive role in preventing cavities, preventing enamel breakdown, demineralization of enamel, and then, of course, gum disease, gingivitis and periodontitis. For us would be obviously calcium, right? Magnesium, vitamin D plays a very, very important role. And then one of the things that we've learned, and again, fairly new, is that for calcium to effectively bind to the actual enamel, we need vitamin K2. This is the X factor. This was the one supplement that they realized was missing. Why? If somebody's taking multiple calcium supplements, but it doesn't actually penetrate, it's not effective. So we find that a lot of people, ladies, for instance, take a lot of calcium supplements, but all they're doing is they're ending up with more plaque. They're ending up with more two-stone and calculus on the teeth. And you can go and check. It's usually because the calcium is not going where it's supposed to. But we need the vitamin K2 to actually transport that calcium into the enamel. Otherwise, it's just wasted in the rest of the blood. So these are the things that, and I mean, then there's more, and this is what we help our patients with. But it's fascinating that these things need to be understood. They need to be applied in the correct way.
And then I had an interesting patient yesterday who brought her little girl with, very smart, and she was the one who informed me that she read about the link between sleeping and teeth because she was looking up on mouth tape. Right, okay. So that's also a fairly new concept that people don't really talk about, is the link between sleeping and your teeth. Can you elaborate a bit on that?
I think what that points to is the fact that we understand about the airway, right? So our contribution from the dental fraternity, from this myofunctional system, it's got to do with the airway. So in other words, snoring, sleep apnea, etc., etc. It's got to do with the position of the jaw. So if I've got an underdeveloped bottom jaw, which when I go down into my REM sleep and this falls back and it obstructs my airway, I'm not going to be able to have that deep sleep, which I need, right? And hence the interrupted snoring and everything that goes with it. So I think, the system, the position of the teeth, the tonus in the muscles, the actual development of it. And it's interesting that she, at this young age, which is brilliant, because that's actually when you want to focus on, from early ages. You say, listen, if I'm going to develop this George Star, for instance, with orthodontics, it's no longer just about getting straight teeth, but also understanding the development of this airway, and it's fascinating. We all know now the value of really, really good sleep. And therefore, again, we have a contribution to make.
So what is lip tape and what other devices do we have to help us with sleeping, snoring? Is there anything in dentistry that can be done, can be made?
Yeah, I to be honest with you, I don't know what lip tape is. Never heard of it. And this also just points to an interesting point. We're also seeing a lot of stuff that goes on social media, right? A lot of our frustration comes from that. Dr. Google, right? So guys will start to sell you anything because they know that people are aware now. They're researching. And then you're going to end up with a scenario where something might completely not be tested, right? So I don't know what that is, but our contribution is that if we understand then that, and again, sleep apnea and sleep and interrupted sleep apnea is multifactorial. And by no means do we ever think that, a dentist is going to solve your problem. We need to consult pulmonologists, endocrinologists, there's general surgeons, ear, nose, and throat specialists. Generally you find these sleep clinics that are really good with it, but our contribution is then the positioning of the bottom jaw. And so therefore orthotic devices. In other words, devices to try and sleep with that positions the jaw in a more favorable position, prohibiting that jaw from falling back. it's a difficult question because there's many of these things on the market today, and some of them are really, really difficult and they're not as accurate. Again, not an exact science, but that is our contribution. So orthotic devices for these sleep apnea and interrupted sleep patterns.
So the technology that is included in all of these things, making orthotic devices, veneers, crowns, etc. What role do they play in fixing failures? What role does the range of technology play in a practice? Is it really important to go to a high-end modern tech practice, or can you get the same value from any other dentist?
I think this is, again, very important question because there's a lot of tech on the market. Like most other industries and group, thank goodness for dentistry as well. Over the last decade, the technological advancements in so many aspects has just skyrocketed. It's a Moore's law. It's taken us into a vertical axis. But I think here again, we point to the fact that not all technology is always helpful. Unfortunately, technology can be quite expensive. And I think here, as a dental team and as dental practices, again, you have to understand what it is that you're trying to achieve first. What is the vision? So if I want to make a veneer faster, more predictable, I want to make it reproducible. That's the goal. Now I can add technology that's going to assist us in achieving those goals versus just buying all the newest machines on the market. It's the same for microscopes, for testing occlusion, testing bites, different types of devices, etc., etc. So technology is amazing, and it's making our lives better. It's making it more accurate. You think about dental X-rays. I mean, some of the stuff that we've been placing dental implants 20 years ago, and it's actually scary sometimes. If we look at the stuff that we've been doing basically blindly, and now we have this wonderful 3D technologies to help us to be more accurate. But again, it's understanding what you're trying to achieve with it and then adding the technology. Technology is not a magic tool. Okay, so in other words, if you still don't know what to do, there's no perfect button just yet that you can press and it's just perfect. You have to understand what you're doing, you have to understand the mechanisms, understand the vision, then add the technology, add the AI, add everything else that's going to come into the future. The biological engineering, the testing, the systematic. We've been working on the system stuff for a while now because why? It's one thing to test it, but also what are you doing with it? So now you have all these machines and it's wonderful. People put it on Instagram and look at all my beautiful millions of rands of technology, but it's not actually adding value. Then it's not worth it versus not investing in technology. You're just not getting that value to the patient. You're still shooting blindly. And so I believe there's a middle pathway, but it's driven by the vision of the practice.
So I want to come back a little bit to an aspect that we spoke about earlier, and where you said we're going to all these, international conferences. And where do you find there's a lack of consistency in dental care or dental quality or standards compared to here or internationally, globally? Why do you think there is that discrepancy and that difference?
Oh, difficult, loaded question. We do see, we're 100% correct, there's a difference. Some of your more affluent cities in the world, where, and I think it's driven by, first of all, passion for the team. It's driven by competition. There's a general willingness and a general drive to be better. So whether it's driven by just the fact that I as a dental team or we as a dental team want to be better and provide better service and value, or do I have to compete with my competition? We all know that competition drives innovation, right? So if there's a lack of competition, then we tend to stagnate, right? And then just your primary dental education and the offering that your city, your town, your country might have. And unfortunately in South Africa, although we have a couple of guys that are doing really, really well with educating dentists, mostly in a private entity, I do feel unfortunately, and again, long conversation about why, but our primary education, our pre-grad education at this point is lacking behind. And there's various reasons, and that's maybe a topic for our next discussion. But the point is that unfortunately, yes. And what it's doing is it's frustrating young dentists coming out of dental school because they're seeing all these things that they can possibly do, but yet they don't acquire the knowledge early on, right? It's frustrating them. It's not their fault. They expect to just go into the dental practice and just to be able to do all these things, drive all this innovation and technology, et cetera, and they're not being taught this. And so therefore we have to understand, but I mean, this would be relevant for everybody all around the world, is that this education never stops.
So if you had any advice to give a young upcoming dentist, we don't normally talk to the dentist. Our aim is the patient.
Of course.
But I do think that there's some value in what would you like the young dentist to know regarding patient care and to make it a better experience for the patient? What's the one take-home thing for interest?
I think for me it would be is to educate yourself as fast as possible. I think it's good for the patient, obviously, should be the primary reason, but also for you as a dentist. Dentistry is a difficult science, right? It's lots of mechanics, there's biology, there's many things, it's engineering, it's art, it's all these things thrown into one, which of course we love. But you have to learn how, and you have to do that as fast as possible. Fortunately today, we don't have to go necessarily to a university to have this done. Online education is so rich. You can access education from anywhere in the world, basically on your phone. So the point is there no longer has to be a time frame necessarily involved in it. I have to do a 5-year course. No, you can do this on your own pace as fast as you possibly can, and that should be your goal. Learn as fast as you possibly can. It's going to empower you. It's going to bring value to the patient, and it's going to give you more peace of mind. So learn.
And then on the other side of the spectrum, what are 3 things, if you think of today, what are 3 things that you can tell patients, if you do this, you might end up in my office less? What is something that they can do for prevention?
Eat better, definitely. I think, again, we understand it. Eat better. Check what you're eating. Don't run into the wall. Check what you're doing with your teeth. They're not tools, right? See the oral hygienist. I think, again, oral hygiene has become at the forefront of what we do if you're talking about preventative care, keeping you out of my office and having to have catastrophic failures and massive treatments. See oral hygiene on a regular basis. And then just educate yourself. Look for teams that really care, that has this passion. That when you walk out there, you feel that, they really, we do all these treatments and sometimes they work out, and sometimes they don't. This is a science. It's the human body that we're working with. But at least go to a team and look for them. All dental teams are not the same. All dental practices are not the same. And it's got nothing to do with the technology that they have. It's about the team. It's about the front desk. It's about the people on the other side. Look for these dental practices. Invest in your health. Invest and build a relationship with them wherever you feel happy and you feel that you're getting some value.
Yeah, I think that concludes most of the questions. Thank you for sharing your expertise and your knowledge and your passion. Obviously, we really appreciate it, and we would love to hear from our viewers. Are there any controversial questions that you have? Anything that you're wondering about, please comment. We would love to hear your side.